All right, welcome back to Pharmacist on Call. Your host, Dr. Shawn Pruitt, and if you are watching this show, I am your community pharmacist. We are going to get right back into your calls. So we've got Linda on line 4. Linda, welcome to Pharmacist on Call. How may we help you?
Hello, Dr. Pruitt. I just have a couple of things for you.
Yes, ma'am.
I purchased the hemp oil.
Yes, ma'am.
And I've had some good results from that.
Good.
I do have a question. I've had quite a bit of trouble with my back and sciatic, and I've had to take, to get through the day, like a half of the hydrocodone, 350.
Yes, ma'am.
Is it okay to still use the hemp oil with that also?
Yes, ma'am. And actually, there's studies to suggest that, well, not for the therapeutic effect, but the hemp oil for people who are actually addicted, it takes away the reward from using opiates. But yeah, I think it's safe to use with your chronic. You'll find that you'll probably wind up using less of your pain medicine in the presence of the hemp oil.
Yeah, well, I'm now in physical therapy for my back and knees and all that. So I just wonder if that's going to be okay. And I want to thank you for getting my GABA 750.
Yes, ma'am. You're welcome.
And also, a friend of mine wanted me to ask you about this. She's had multiple back surgeries, and she doesn't want to have to continue taking her opioids and all that kind of stuff. Which of the hemp oil should she use? The one that's, does it have, well, there are two prices. You remember the one that I bought? Okay, is that the one that she should buy, or it should be another one?
She would use the concentrated formula, the black formula.
Like I bought?
Yes, ma'am.
Okay, all right. And how many drops a day can you have?
Well, that's going to be individual for each person. You can go fairly high. So I have one lady who uses it for fibromyalgia.
Right.
10 drops gets her, the pain relief that she needs. So your friend may need more or less. And so that's why we say a good starting dose with the black formula, somewhere between 1 and 3 drops, and then just adjust it daily. So maybe once a day, because it does have a pretty decent half-life, which is about 9.5 hours, is what it takes for your body to kick out at least half of it.
Okay, well, I just wasn't sure if I could take like a half a hydrocodone plus, say, 3 drops, and if that would be enough, or if that was not kosher to do.
I would not do them at the same time.
Okay.
So you can do the oil first, and then if you're starting to notice a little edge after a few hours, then you can take the half of hydrocodone.
Okay. All right. Well, I can't think of anything else. I appreciate all of your suggestions that have worked, and hope everybody gets on turmeric
yes, ma'am.
for arthritis and inflammation, and some beetroot juice for their blood pressure and their diabetes.
That's right. That's right.
Okay. Thanks a lot.
Yes, ma'am. Thank you. All righty. All righty. All right. Bye-bye. Linda, our #1 fan. So yeah, she calls in quite often and also comes in the pharmacy. Okay, looks like we've got Thelma. Welcome to Pharmacist on Call. How may we help you?
Yes. Hello, Dr. Pruitt. Happy New Year to you and the staff.
Thank
How are you?
Pretty good. How are you? Happy New Year.
Thank you. I'm good. I wanted to know if there was any reason to not have a negative interaction between turmeric and the beetroot juice. If there would be any contraindication in taking those, say you take the beetroot juice, a capsule of it in the morning, and take the turmeric later on in the afternoon with a meal. Would they have any negative interaction together?
No, ma'am, they would not.
Okay.
No, they would. So they're perfectly safe together. Again, beetroot juice coming from beets, and turmeric, basically a spice, your curry spice. I would say with the turmeric, if you are a person who's on blood thinners, maybe use it with some caution, because turmeric can also thin the blood a little bit, which is why it is good in patients who have high blood pressure or who have heart issues, because it does keep the blood flowing and thin. So I would use it with caution, and maybe the beetroot juice too.
Well, that is good. All right, good to know.
Good question.
Thank you very much, Dr. Pruitt.
Yes, ma'am. All right, thank you.
Have a great evening.
All right, you too.
Bye-bye.
All righty, bye-bye. Kim, welcome to Pharmacist on Call. How may we help you?
Did you say Kim?
I did. Yes, ma'am.
Sorry. How are you?
Pretty good. How are you?
I am well. I have a question.
Yes, ma'am. Fire away.
I take Suboxone
Okay.
and Zoloft, and I'm on Trazodone now.
Okay.
And I wondered if this Garcinia Cambodia stuff that you were talking about.
Yes, ma'am.
I noticed you said it had a mood altering effect as far as depression.
Yes, it does.
Can I take that with this?
What dose of Zoloft are you on?
I take 200 milligrams.
Okay. Are you?
Oh, I'm sorry, 150.
150. Is that Trazodone or is that Zoloft?
No, I take 150 of the Zoloft, and
Okay.
he actually put me on a higher dose of Trazodone, but what I found out is it's too much, so
Okay.
I take like 50 milligrams of Trazodone at night.
I would use it in caution with you because it's going to push up your serotonin even further. Also in the presence of the Zoloft, so it works the same way that your Zoloft does. It increases your serotonin levels.
Okay.
Yeah, so I would think maybe about backing off of your dose, factoring in that you're also going to have a boost from Garcinia. Yeah, but I would recommend using it with caution or maybe not using it at all.
Oh, really? Okay. Would you recommend another weight loss supplement or something to that effect?
Gee, that one just does so well. Yeah, if not for that whole serotonin piece. I tell you what, give me a little time to think about it and do a little research, and I'm sure we can come up with something. The Mother Nature is full of options.
Yeah, that's true.
Yes, ma'am.
Okay, well, I will check back. I really appreciate it.
Yes, ma'am. Thank you for calling.
Thank you.
All right, you're welcome. All righty, bye. AJ, welcome to Pharmacist on Call. How may we help you?
Yes, Dr. Pruitt. How are you?
Pretty good. How are you?
Good. This is my first time calling in, so I was just curious to know what would you recommend for like a deep congested cough that's over the counter, that something safe to use.
Okay, are you producing anything, or is it a dry cough?
No, mucus is coming up, and it's actually, kind of like a greenish brown. And I've been taking the Walgreens Severe Cold tablet.
Yes, ma'am.
And so I'm just trying to see what else maybe will help open up the bronchial tubes to get all that out.
Well, unfortunately, it's going to require a doctor's visit, because now we have gone into where it's more than just a cough, because if the sputum is green or brown, then that lets me know we're really tick. And so we're going to need some antibiotics.
Okay.
Yeah, but also you can use something like a Robitussin DM or Mucinex would be great for helping to break it up. And when you do that, take it every 12 hours with a full glass of water. The water helps the mucolytic effect break up that phlegm. But yeah, you're gonna need some antibiotics with the sputum changing color like that.
Okay. Well, all right. Thank you so much.
Yes,
sir.
ma'am. Yes, ma'am. You're welcome.
All right. Bye-bye.
All righty, bye-bye. All right, let's see who we've got here. Gary, welcome to Pharmacist on Call. How may we help you? Hello, Gary? Gary? Jerry?
This is my first time calling, man, and I just happen to be flipping through the channels, and this is not really a question.
Go ahead.
Hello?
Yes, sir. Go ahead. I'm listening.
Can you hear me?
I can hear you.
Oh, okay. Yeah, I was calling in. I was flipping through the channels, and I seen you, man, and I've been suffering from alopecia since I was 13.
Okay.
And, I've always struggled with it. I'm 40 years old today, and I still struggle with it. But I see you, and I see you sitting up there so proudly. And I've been wearing a hat every day of my life since I was 13. And I had a couple questions. How did it not affect you? And is there a cure, and do you ever think they will find a cure? And thank you for accepting my call, Doc.
Hey, no problem, man. And I'll just answer off the call. So he brings up an interesting point. So yours truly also affected by alopecia areata. And so it is an autoimmune disorder where my immune system and others who are affected by it, our immune system attacks our hair follicles. And I'd say it probably kicked in me maybe the last year or so. So you can see I went baby face in some of my older shows. You see a full beard and bushy eyebrows and all of that. There is no cure. And I don't even think they know what really causes it. But I think there's probably a genetic component to it because someone who knew my great-grandfather also said that he had it as well. But as far as I know, it's an autoimmune disorder and untreatable. So I would probably look at maybe thyroid or maybe some other kind of a hormonal thing. So in fact, yeah, I haven't even really addressed it yet. So I do need to start looking into it myself. It hadn't really bothered me because I've been, rocking the bald head for such a long time. But I will probably address alopecia areata in subsequent shows. But great call. I finally got a chance to talk about it. All right, so everyone stay right there. We are up on another break. We'll be right back.